Welcome to our exploration of psychiatric disorders and their pharmacotherapy. Mental health is more than just the absence of illness. It's a state of well-being where individuals realize their potential, cope with life stresses, work productively, and contribute to their communities. According to the World Health Organization, mental health involves successful performance of mental functions like thought, mood, and behavior. When these functions are disturbed, psychiatric disorders can arise, leading to distress or disability. In this video, we'll break down the definitions, causes, symptoms, and treatments of psychiatric disorders, providing a comprehensive overview for anyone interested in mental health. Nearly 500 million people worldwide suffer from mental or behavioral disorders. Depression alone affects over 150 million people, while schizophrenia impacts 24 million. Children are not immune, with 10–20% experiencing mental health issues. Substance abuse is rampant, and tragically, around 800,000 people die from suicide each year. Mental and behavioral disorders account for 12% of the global disease burden, and the gap between those needing treatment and those receiving it continues to widen. About a quarter of the world's population will develop a mental illness at some point, with the majority living in developing countries where resources are scarce. Let's take a closer look at mental health in Ethiopia. Common mental disorders affect 12–17% of the population, while schizophrenia is seen in 0.607%. Mood disorders, childhood disorders, substance dependence, and problem drinking are also prevalent. Cot abuse is particularly high, ranging from 22–64%. Suicide attempts and completed suicides are significant concern. These statistics highlight the urgent need for mental health services and awareness, especially in regions where cultural factors and limited resources may hinder access to care. World Health Organization emphasizes that governments are just as responsible for mental health as they are for physical health. The need for action is urgent and indisputable. Integrating mental health services into general healthcare, especially at the primary care level, is crucial. Contrary to common misconceptions, most people with mental disorders are not violent. Only a small proportion are associated with increased risk of violence, and comprehensive mental health services can actually reduce this risk. The impact of mental disorders extends far beyond the individual, affecting families and entire communities. Causes mental illnesses. Traditionally, explanations range from supernatural forces and witchcraft to evil spirits and ancestral influences. Modern science, however, recognizes that the causes are complex and often not fully understood. Mental illnesses typically result from a combination of biological, psychological, and social factors. These causes are often remote in time and can be ambiguous, making diagnosis and treatment challenging. Understanding these multifaceted origins is key to effective prevention and intervention. Biological factors play a significant role in the development of psychiatric disorders. Genetics can predispose individuals to conditions like schizophrenia. Neuropathological changes, such as those seen in dementia, and endocrinological imbalances like hyper or hypothyroidism can also contribute. Biochemical factors, particularly involving neurotransmitters, are often implicated. Even side effects from medications or metabolic issues like diabetes can influence mental health. Recognizing these biological underpinnings helps guide appropriate pharmacological interventions. Psychological factors such as distorted thinking, emotional dysregulation, and behavioral problems can contribute to mental illness. Unconscious conflicts and significant life events like migration, unhappy marriages, or work and financial stress also play a role. Social factors, including lack of family support, criticism, or overprotection, further complicate the picture. The interplay between these psychological and social elements often determines the onset, severity, and course of psychiatric disorders. Psychiatric disorders often manifest as variations in normal functioning. Deviations can occur in the intensity, duration, or timing of thoughts, moods, and behaviors. These symptoms are highly context-dependent, meaning what's considered abnormal in one situation might be normal in another. Recognizing these subtle differences is essential for accurate diagnosis and effective treatment. Let's dive deeper into the specific types of symptoms seen in psychiatric disorders. Thought disorders can be classified into disorders of form and content. Disorders of thought form focus on the process of speech. For example, circumstantiality involves speaking with excessive, irrelevant details but eventually reaching the point. Tangentiality, on the other hand, is when someone never gets to the point, often seen in psychotic disorders. Loosening of associations where speech becomes incoherent is a hallmark of schizophrenia. Neologisms, thought block, perseveration, flight of ideas, and clang associations are other examples, each linked to specific psychiatric conditions. Disorders of thought content include obsessions, delusions, and suicidal or homicidal wishes. Obsessions are intrusive, recurrent thoughts that cause distress, often followed by compulsions, actions performed to relieve anxiety. Delusions are fixed, pathological beliefs not shared by others in the person's culture or background. These can take many forms, such as grandiose, persecutory, or nihilistic delusion. Understanding the difference between thought form and content is crucial for accurate diagnosis and treatment planning. Obsessions are excessive, intrusive thought that the patient recognizes as originating from their own mind. These thoughts often lead to compulsions, repetitive actions performed to reduce anxiety. For example, someone obsessed with contamination may compulsively wash their hands. Compulsions can also include praying or other rituals. This cycle of obsession and compulsion is most commonly seen in obsessive-compulsive disorder, but can appear in other conditions as well. Delusions come in many forms. Grandiose delusions involve beliefs of special powers or abilities, often seen in bipolar disorder and schizophrenia. Persecutory delusions are characterized by the belief that others are plotting harm, such as thinking family members are poisoning food. Other types include delusions of infidelity, reference, erotomania, guilt, nihilism, enormity, and olfactory delusions. Each type provides insight into the underlying psychiatric condition and helps guide treatment. Passivity phenomena are distressing experiences where patients feel they have no privacy or control over their thoughts and actions. This includes delusions of control, thought withdrawal, thought insertion, and thought broadcasting. These symptoms are commonly associated with schizophrenia and can be deeply unsettling for those affected. Recognizing these phenomena is important for both diagnosis and empathy in care. Speech disorders are another key feature in psychiatric assessment. These include stuttering, poverty of speech, pressured speech, mutism, echolalia, and aphasia. Mutism or refusal to speak is often seen in catatonia and conversion disorder. Echolalia, the repetition of another's words, is also suggestive of catatonia. Understanding these speech patterns can provide valuable clues to the underlying psychiatric condition. Aphasia refers to language impairment and is commonly divided into Broca's expressive and Wernicke's receptive types. Broca's aphasia is characterized by nonfluent speech, but the patient understands what's being said and tries to respond, often with body language or mispronounced words. Wernicke's aphasia, on the other hand, involves fluent but nonsensical speech, with the patient unable to comprehend questions. These distinctions are important in both psychiatric and neurological contexts. Perceptual disorders involve sensory distortions and deceptions. Sensory distortions occur when a real object is perceived in a distorted way, such as changes in intensity or size. Sensory deceptions include illusions, misinterpretations of real stimuli, and hallucinations, which are perceptions without any external stimulus. Hallucinations can be auditory, visual, olfactory, tactile, or gustatory, each providing important diagnostic information. Hallucinations are classified by the sense involved. Auditory hallucinations involve hearing voices or sounds that aren't there, while visual hallucinations involve seeing things that don't exist. Olfactory hallucinations are related to smells, tactile to touch, and gustatory to taste. Each type can be associated with different psychiatric or neurological conditions, and their presence often signals the need for urgent evaluation and intervention. Memory is a complex function, divided into sensory, immediate, short-term, and long-term types. Immediate recall is tested by asking a patient to repeat words, while short-term memory involves recalling recent events like what was eaten for lunch. Long-term memory allows for recall of distant events such as historical facts. Assessing these different types of memory helps identify specific impairments and their possible causes. Memory can be further divided into explicit, declarative, and implicit procedural types. Declarative memory is for facts and events like knowing the capital of a country. Procedural memory involves skills and tasks such as swimming or driving. Distinguishing between these types helps in understanding the nature of memory impairments and tailoring rehabilitation strategies. Memory impairments are generally classified as amnesias, or loss of memory, and paramnesias, or distortions of memory. Amnesia can be partial or total and may have organic or psychogenic origins. For example, dissociative amnesia occurs after extreme trauma, while Korsakoff syndrome is linked to chronic alcohol use and thiamine deficiency. Understanding these distinctions is essential for proper diagnosis and management. Amnesia can be further divided into anterograde and retrograde types. Anterograde amnesia is the inability to learn new information after the onset of the disorder, while retrograde amnesia is the inability to recall previously learned material. These distinctions help clinicians pinpoint the nature and location of brain dysfunction, guiding both treatment and prognosis. Emotional disorders are common in psychiatric conditions. Emotion is a stirred-up state caused by physiological changes in response to events, leading to feelings like depression, anxiety, or fear. Mood, on the other hand, is a pervasive and sustained emotional state. Describing mood involves understanding what the person feels over time, which is crucial for diagnosing conditions like depression or mania. Affect refers to short-lived emotions, often inferred from facial expressions. It can be described as normal, constricted, blunt, or flat. Flat affect, where emotional expression is severely reduced, is often seen in schizophrenia and other severe psychiatric disorders. Accurate assessment of affect and mood helps clinicians understand the patient's internal experience and tailor interventions accordingly. Normal emotional reactions are those accepted by culture under certain circumstances, such as grief after a loss. Abnormal reactions, however, are prolonged and impair functioning. Examples include morbid sadness and depression, elation in mania, and irrational fear in anxiety disorders. Recognizing the difference between normal and abnormal reactions is key to identifying when intervention is needed. Ability of affect refers to rapid and abrupt changes in emotion that are largely unrelated to external stimuli. This is most commonly seen in dysphoric mania, but can also occur in other psychiatric conditions. Such emotional instability can be distressing for both patients and those around them, highlighting the importance of emotional regulation in mental health. Experience of self involves four key aspects: awareness of self-activity, unity at any given time, continuity of identity, and separation from the environment. Disturbances in any of these areas can lead to significant psychiatric symptoms, such as derealization, depersonalization, or a breakdown of ego boundaries. Understanding these aspects helps clinicians assess complex cases and provide targeted support. Realization is a mental state where the environment feels unreal, almost dreamlike. People and objects may seem distant or artificial. This often occurs in severe depression or during panic attacks. Patients may describe feeling detached from their surroundings, which can be deeply unsettling and impact daily functioning. Recognizing derealization is important for accurate diagnosis and empathetic care. Depersonalization involves feeling as if one is observing oneself from a distance, almost like being two people at once. This symptom is common in borderline personality disorder and major depressive disorder. Patients may feel disconnected from their own thoughts, feelings, or body, which can be frightening and confusing. Understanding depersonalization helps clinicians provide reassurance and appropriate intervention. Individuals, especially those with schizophrenia, may feel they are not the same person they were before their illness. They might even claim to have been reborn. This disturbance in the continuity of self can be profound, affecting identity and sense of purpose. Recognizing these experiences is crucial for understanding the depth of psychiatric disorders. Breakdown in the boundaries between self and environment is a hallmark of schizophrenia. Patients may feel their actions are controlled by external forces, leading to a loss of autonomy. This experience can be deeply distressing and is often accompanied by other symptoms like passivity phenomena. Understanding this breakdown is essential for effective treatment and support. Consciousness refers to awareness of oneself and the environment. Disorders of consciousness are often associated with problems in attention and orientation. Clinically, disturbances are assessed by checking orientation to time, place, and person. Disorientation, especially if it develops rapidly, may indicate delirium, which is usually secondary to an underlying medical condition and requires urgent attention. To assess consciousness, clinicians test a patient's orientation to time, place, and person. If a patient is disoriented, especially with rapid onset and fluctuating levels of awareness, delirium should be suspected. Delirium is a medical emergency and often points to an underlying physical illness. Early recognition and intervention can significantly improve outcomes. Today's digital age, social media plays a significant role in shaping mental health. While it can foster connection and support, excessive use or exposure to negative content can contribute to anxiety, depression, and low self-esteem. It's important to be mindful of how social media affects our thoughts, emotions, and behaviors, and to seek balance in our online and offline lives. Pharmacotherapy is a cornerstone in the treatment of psychiatric disorders. Medications can help manage symptoms, restore functioning, and improve quality of life. The choice of medication depends on the specific disorder, symptom profile, and individual patient factors. Ongoing monitoring and adjustment are often necessary to achieve the best outcomes. Antidepressants are commonly used to treat mood disorders such as depression and anxiety. They work by balancing neurotransmitters in the brain, helping to alleviate symptoms like sadness, hopelessness, and lack of energy. There are several classes of antidepressants, each with its own benefits and side effect profiles. Finding the right medication may take time and careful monitoring. Antipsychotic medications are primarily used to treat conditions like schizophrenia and bipolar disorder. They help manage symptoms such as delusions, hallucinations, and disorganized thinking. Like all medications, antipsychotics can have side effects, so regular follow-up with healthcare providers is essential to ensure safety and effectiveness. Mood stabilizers are used to treat mood swings, particularly in bipolar disorder. These medications help prevent episodes of mania and depression, allowing individuals to maintain a more consistent emotional state. Common mood stabilizers include lithium and certain anticonvulsants. Monitoring for side effects and blood levels is important for safety. Anxiolytics are medications designed to reduce anxiety. They can be helpful for short-term relief of severe anxiety symptoms, but are generally not recommended for long-term use due to the risk of dependence. Non-pharmacological approaches such as therapy and lifestyle changes are often recommended alongside medication. All psychiatric medications can have side effects, ranging from mild to severe. Common side effects include weight gain, drowsiness, dry mouth, and sexual dysfunction. It's important for patients and providers to communicate openly about any side effects experienced, as adjustments to the treatment plan may be necessary. While medications are important, non-pharmacological treatments like psychotherapy, lifestyle changes, and social support play a vital role in managing psychiatric disorders. Cognitive behavioral therapy, mindfulness, and regular exercise can all contribute to improved mental health. A holistic approach that combines medication with these strategies often yields the best results. Stigma remains a major barrier to seeking help for mental health issues. Misconceptions about mental illness can lead to discrimination and isolation. Education, awareness, and open conversations are key to reducing stigma and encouraging individuals to seek the help they need. Everyone deserves access to compassionate and effective mental health care. Family and community support are essential for recovery from psychiatric disorders. Positive relationships, understanding, and encouragement can make a significant difference in outcomes. Communities that foster inclusion and provide resources help individuals feel valued and supported throughout their journey to mental wellness. Integrating mental health services into primary health care systems is a key strategy recommended by the WHO. This approach ensures that mental health is treated with the same importance as physical health, making services more accessible and reducing the treatment gap. Training primary care providers in mental health can lead to earlier detection and better outcomes. Future of mental health care lies in continued research, innovation, and collaboration. Advances in pharmacotherapy, digital health tools, and community-based interventions hold promise for improving outcomes. Reducing stigma, increasing access, and promoting holistic care will remain central goals as we move forward. Summary: psychiatric disorders are complex conditions influenced by biological, psychological, and social factors. Effective treatment requires a combination of pharmacotherapy, psychotherapy, and community support. By understanding the signs, symptoms, and available treatments, we can work together to improve mental health outcomes for individuals and communities worldwide. Thank you for joining us on this journey through the pharmacotherapy of psychiatric disorders.